For discussion post 5, my group read the article by the Robert Wood Johnson Foundation, Catalyst for Change, Harnessing the Power of Nurses to Build Population Health for the 21st Century. First, some background facts about the costs in healthcare. Our nation spends more on healthcare than any other country, and those costs continue to increase. There's a decrease in spending on public health and an increased demand by payers for quality and value over volume. The U.S. is a leader in developing cutting-edge medical technologies, pharmaceutical products, and healthcare treatment innovations, but has the highest healthcare cost per capita than any other country. The U.S. is not keeping up with the pace of other economically advanced countries. In 2015, life expectancy declined for the first time in 22 years. 65 and older population is expected to increase from 46 million to 96 million by 2060, thus increasing the need for nurses to care for this aging population. Also, the public health workforce has declined 22% between 2008 and 2016 due to reduction in funding for public health. There will be a retirement of 1 million registered nurses between now and 2030. This means a decreasing amount of knowledge and experience in the workforce at a time when nursing demand increases. Nurses are well positioned to identify issues affecting the health and well-being of individuals, discern patterns across patient populations, link patients with community resources, and develop broad-based interventions. So where nurses come in. We're the most trusted profession. Our training and education emphasizes well-being and holistic preventative care. We work in several key community settings, including hospitals, skilled nursing facilities, schools, businesses, and homes. Key drivers of the population health strategies. First is the social determinants of health. These are the factors outside of healthcare, such as living conditions and quality of life in the community. Also, health inequities, helping more people make healthier choices, making healthcare services more accessible to everyone. Third, lack of access to affordable clinical care. Compared to other high-income countries, the U.S. has a higher number of uninsured citizens who often pay high out-of-pocket expenses for insured people. Health behaviors. Campaigns for reducing negative behaviors in the community, like smoking, lead to positive results. Trends that affect the role of nursing in improving population health. First is healthcare reform. And second and third, like I mentioned before, is an aging population and an increase in nurse retirements. Third is the changes in the public health system. Reduced funding has caused a decrease in staffing of public health departments. Also, technological changes. There's been an introduction of telehealth, the use of EHRs, and the use of mobile devices in the healthcare setting. Finally, there's been a shift towards consumerism, an approach based on viewing patients as clients or consumers. This empowers the patients to take an active role in their care. To improve public health, nurses should focus on building strong nursing leadership, enhancing the nursing workforce, diversifying the workforce, getting better at graduating new nurses and retaining good nurses, clearly establishing their value proposition, investigating how nurses can reduce costs and improve outcomes, and finally, making decisions based on public health research data. So what is population-focused nursing? The Minnesota Department of Health defines population-based practice as one that focuses on an entire population. It's grounded in an assessment of the population's health status, considers the broad determinants of health, emphasizes all levels of prevention, and intervenes with communities, systems, individuals, and families. There's a strong role of nurses that nurses need to fill to improve public health. There are leadership roles in state and local public health agencies. There's data analysis roles and nursing roles in schools. There are 5 key recommendations to achieve population-focused nursing. First is to transform nursing education. We need to ensure that nursing curriculums incorporate perspectives that are population-focused, ones that collaborate with professionals as part of the community that impact community health. We need to make sure to prepare nursing students to work on multi-professional teams and promote a diverse nursing student population, one that better reflects the diversity of the community. Second is to transform nursing practice, to support interprofessional collaboration, to connect patients and their families to resources in the local community, to ensure that all schools have access to nurses with public health training, and to improve the use of research data in decision making. Third, we need to promote nurse leadership with a population focus. We need to choose nurse leaders who understand the context of the community, promote mentorship strategies and nurse leadership residencies, support leadership with a values versus volume focus, and encourage the inclusion of community members in these decision making. Fourth, we need to support nursing research into public health topics. We need to promote and participate in research on public health nursing initiatives and advocate for adequate funding into population health research. Fifth, we need to support pre-existing policies. A number of public health initiatives are already in place. Nurses need to familiarize themselves with these initiatives and support them. There's a population health model. The National Advisory Council on Nurse Education and Practice defines population health as the health outcomes of a group of individuals, including the distribution of such outcomes within the group. The Minnesota Department of Health defines population-based practice as one that focuses on entire populations, is grounded in an assessment of the population's health status, considers the broad determinants of health, emphasizes all levels of prevention, and intervenes with communities, systems, individuals, and families. In our country, the passage of the Affordable Care Act increased the emphasis on population health as a new focus for healthcare. The emphasis on primary care and preventative care help many people stay healthy, avoid chronic conditions, and reduce the need for hospitalization. In conclusion, nurses are to be advocates and ask patients the right questions, which can help plan more effective interventions. What do you have access to? Education and job opportunities, physical and mental health care, housing, clean drinking water, fresh food, transportation, public safety, social support. And finally, nurses also need to ask themselves, are you aware of social services agencies around you? Can you connect your patients to the services they need? And are you aware of social inequalities in your community? Thank you for listening.